Welcome to my channel. Um, I'm Mel. You can call me Mel for short. I'm a registered nurse by profession, and today I will be teaching you what to do in case somebody fell. First, we would be checking from head to toe. We will assess the patient. You're gonna ask the patient what happened, and you can quote exactly what the patient would say. For example, uh, sometimes the patient is confused. She would say, I didn't know I was walking and suddenly I fell. I didn't know exactly what happened. Okay. Then we will check if the pupils are equal and reactive to light. We will use a pen light for it. It's very handy if nurses have pen lights with them always. So if somebody fell, you can always do the neuro checks. Okay, and you're gonna check the head if there's any bumps on it, and you would ask the patient to, did you hit your head? Some patient, if they are confused, they would say, I don't know, because they didn't really know what exactly happened. And after checking the head, you would check for any bruises or any wounds, any skin tears, and you would ask, the patient, do you have any pain? Sometimes some patient would deny, I don't have any pain. And you would also ask the patient, okay, um, hold my hands and squeeze my hands. Because if the patient has some neurological defects, they would not be able to move their hands. And tell the patient too, okay, can you move your legs? If the patient can move their legs, it means that it's fine because if it's really a bad fall, some patient wouldn't be able to move their legs. And after that, if, for example, the patient complains of pain, I have pain on my hip, feels like I broke something on it. Of course, you would immediately tell it to the doctor, and the doctor would order an x ray for that part that has pain. Okay? And then, after doing your assessment, you can put in your progress note, for example, at what certain time the patient fell, like at 800 hours, reported to writer that patient fell. Then writer went to patient to assess, and writer asked what happened. Patient stated, I don't know what happened. I just found that I'm on the floor. And then, of course, you will do your, or you will write down your assessment from head to toe. You will say that uh, writer assessed the patient and pupils are equal and reactive to light. There's no bumps noted on the head when checked, and then no apparent injury at this time. Denies any pain, able to move all four extremities within patient's limit. Okay, and then of course, neuro checks should be done like 4 times or Q 15 minutes for the first hour, and then Q 30 minutes 4 times too after that one, and Q 1 hour 4 times also, and then Q 4 hours after. It's 4 times 2. Uh, why are we doing the neuro checks? Because we just want to make sure that the patient is fine and there's no neurological defects uh, that the patient sustained during that fall. Okay? Because if it's really a bad fall, for example, the patient broke her her neck or something, you really should not move the patient. And if it's a fall that has really, an injury, like you can see that patient has hematoma on the head or on the forehead, you should send the patient to the ER. Ask the doctor, doc, can I get an order to send the patient to the ER? Because you don't want your license to be in jeopardy. You just want to make sure that the patient is fine, that there's no blood clots or anything in the head. Just to make sure that the patient is really good, even though the patient sustained that fall. And after you do your assessment from head to toe, we would get the patient's vital signs. Of course, vital signs is so important. We always want to have the baseline of the patient. You would also include the interventions that you did for the patient, and you would put it in your progress note. For example, if the patient sustained a skin tear, you would put the treatment rendered, uh, dressing placed on the skin tear of the patient. And as a protocol, we always measure the skin tear. How many centimeter it is, how long is the skin tear, and also the width. And aside from that, we would also put in our progress note measures like kept bed in low position and call light placed within reach. Of course, we did also have to make our investigation regarding the fall. If the fall was caused by environmental issues like the floor is wet, but mostly it's not the case. So, as a nurse, we should really try to look into it. Some causes of fall is because a patient overestimates their capacity. Like, for example, they thought that they can still go to the bathroom and do things by themselves, especially if the patient is, in their 80s, 90s. They really thought they still, can do everything by themselves. So we just want to assess how the patient is. If she cannot, you know, do everything, um, unlike before, we should always, document it, that how the patient is doing with ADLs. Is the patient extensive assist with one person, or limited assist with one person, or just for supervision? Okay. If you find this video helpful, please click the like and subscribe to this channel. We would be featuring a lot of nursing stuff, just to share with you what we do at work, and also, just advice tips for nurses and nurses to be. Okay, once again, thank you so much. Take care and God bless. Bye.